Just getting started here, setting stuff up to go live, talking about sports injuries of the shoulder, hip, and knee. I am just about to get started answering questions that you may have on any of these injuries that I treat. So, I am a sports surgeon, orthopedic surgeon. I treat athletic injuries of the shoulder, hip, and knee, and I do these lives about once a week to go over any of your questions on shoulder, hip, and knee injuries and just try to give some general knowledge and info on what I do as an orthopedic surgeon and also ways to recover after sports injuries. So, about to get started in a second. Thanks for joining in, folks. I see some people are already on here. I'll give it about a minute or so to allow people to join and then start asking questions. Again, if I don't answer your question because I don't get to it, I will be sure to try to get to it in a DM or a comment, and I'll try to answer your question. Again, I'm just giving some general background information here. No real medical advice. I'm just giving you some educational tips and tricks about sports injuries in general. And I'll hope that some of the information is helpful for you. So thanks for starting with me, and I'm going to answer some questions and get going. So D Hoop says 6 months post-op on patella tendon tear. When should I expect to be back 100%? So patella tendon tears, obviously a very devastating injury. Typically, when it's repaired appropriately, you can expect to get the ability to play your sport or go back to activities within about 9 months or so after the surgery. But that changes based on your activity level, your strength, and your rehab. Thanks for the question. Dom says, what paths do you take to become specialized in sports medicine? So I did orthopedic surgery residency, and then I did a sports medicine fellowship for 1 year. Residency is 5 years. Fellowship is um, one year additionally. Um, thanks for the question. So BD says how to treat to the thigh. Very hard to work, Ben. So I can't, I don't understand your question. Sorry. B says, how did you excel in college science classes? I I actually did not take science as an undergrad, so that's a whole separate story. I was a political science major in college, and I had to go back to school to take all my pre-med classes. So I'm not the typical um, pre-med science major for medicine. So it is possible to do become a doctor after doing a separate major in college. Um, so uh, Nick says, will my patella tendons ever go away? I had my ACL replaced with my patella tendon. So that's a great question. So ACL reconstruction can be performed with the patella tendon. And the major complication after an ACL reconstruction with patella tendon is pain in the knee, in the front of the knee around the patella and the patella tendon. And unfortunately, this happens in about 30% of people. And it can last a long time and linger for a lot of people. So if you have patella issues after patella tendon harvest for patella tendon ACL reconstruction, that might be something that lingers for a long time. So that's one of the major complications of that type of surgery. So GVO Jason says Oscar Sliders has been bugging me for about 3 months now. Cut back activity and still feel pain. So Oscar Sliders is a disease that affects adolescents for the most part. It is due to excess stress and overuse on the patella tendon, on the insertion of the patella tendon at the tibia, and that can cause pain and dysfunction for a lot of people. And it can last quite a bit of time. But usually, what happens and what helps is the first kind of coming back on your sport and resting it and doing physical therapy, working on stretching the hamstring specifically, and then and strengthening the hamstring, but also the growth of the growth plate, which actually closes at 14 for girls and 16 for boys. So it may take time for that to go away. Uh, the shoulder sleeper says, what would you say is the most common complaints in patients following surgery? That's a general question, but in general, patients complain of, other than some pain from postoperative issues, sometimes they complain of stiffness. The stiffness, as I would say, would be one of the biggest issues for a lot of these patients in joint surgery. So stiffness is the biggest complaint, I would say. So I'm going to skip around. I see a couple patients that I operated on. Thanks for joining in. Um, and so Um, so Ben Lame 187 says, I was playing tennis. All of a sudden, my calf felt serious pain. I can't walk. So the um, one of the injuries in tennis in the lower extremity is something called tennis leg, and that could be from injuring your calf or injuring one of the tendons in your legs. And many times that is a very serious injury. So I would suggest someone see an orthopedic surgeon if there's a serious pain in your calf after a tennis injury, specifically if it's a stopping or starting type of movement that causes pain. So it can be an injury to the calf that might be anywhere from a tear to a sprain or strain in the tendon there. Um, so Bryce says, what's your suggested treatment for exercise-induced compartment syndrome in the calf? So exercise-induced compartment syndrome can be a very debilitating condition, especially in athletes, because that means that you get pain, sometimes some numbness and tingling in the leg with exercise, because the compartments in the leg are very tight and get very, it compresses a lot of vascular structures and neurologic structures. One of the things that you do is to try to, one, limit your activity if you can. And in rare cases, I've had to do surgery to basically release the compartments of the leg to give it more space and to prevent the compression that can happen with this. And so I'm going to be very specific in my answers that I answer because I'm a shoulder, hip, and knee surgeon. So some folks are having questions about ankle, foot, and wrist or back, but I do shoulder, hip, and knee. So I'm going to be very specific in what I answer. So sorry if I don't answer those specific questions about those other body parts, but I do shoulder, hip, and knee. Um, and I do shoulder, hip, and knee joint preservation for the most part, not joint replacement. So pretty specialized here. So what's the best treatment for OCD in the knee? Siru Tho is asking that question. So OCD in the knee basically means that the cartilage has been wearing out with the bone as well in the knee, and that can be very painful and basically lead to arthritis if it's not addressed appropriately. So what I do for osteochondral defects in the knee is to reconstruct the cartilage or make new cartilage in a certain way. So it depends on where the defect is. You can either transplant cartilage from one part of your knee and put it into that defect. You can get a cadaver transplant into that knee defect, or you can actually regrow cartilage by taking a sampling of your own cartilage, send that sampling to a lab, and that lab will regrow cartilage-like cells, and that can be implanted into the knee. All these techniques work for different reasons and for different indications, but I have a very, very kind of strict protocol and algorithm to follow in terms of improving patients' outcomes after OCD. MK11 says, can an asymptomatic minor meniscus tear cause arthritis without surgery? So the meniscus is the shock absorber in the knee. It helps to dissipate the stress in the knee, is therefore very important for preventing any problems with the knee, such as arthritis. And so it is possible that these small meniscus tears are actually precursors to arthritis in the future. So I would say if you know you have a of a meniscus tear, either do physical therapy to appropriately treat that pain from that meniscus, or have it addressed appropriately with physical therapy, or have it appropriately addressed with surgery if it lingers and causes problems in the future. But it basically is one of the issues that can lead to degeneration of the knee and cause arthritis. So Danus Jack says, do you recommend delayed return to sport with an allograft post ACL surgery? So that's a great question. So an allograft is a cadaver graft that is taken from someone who's deceased, and you use that to make a new ACL. And it has been shown that patients who have ACL allografts, so a donated graft or a donated tissue, can have worse outcomes after ACL reconstruction. But specifically, the outcomes are worse in patients who are younger than age 40 and who are highly active. And I personally do not do allografts in that population unless it's under some certain very specific circumstance. And so I would say if someone is very active and plays a sport competitively and they have had an allograft, you should be very aware of the possibility that you have a higher chance of re-tearing your ACL if you go back to a sport at a high level and you've had an allograft ACL. So Khalil says, what about lateral extra-articular tenodesis? That's a great question. So lateral extra-articular tenodesis is a procedure that is now more commonly performed in ACL reconstruction. And it is a procedure that has been shown to add extra stability to the knee after an ACL reconstruction. And it has been shown in multiple studies that it can decrease the recurrence rate of tears after a ACL reconstruction. So in my opinion, it is one of the more common things that I do in a patient who is a very active and competitive athlete and is undergoing the ACL reconstruction. So I would definitely encourage a lot of folks to have a lateral extra-articular tenodesis if they meet the proper indications, such as if they're young, healthy, and they are competitively playing their sport at a high level. So it's making me thirsty. So T.R. Sterner Jr. says, I have a half torn and stressed ACL for a year now. Is there any way I can still get surgery for it? So I would say that what you're describing is basically a torn ACL. And if you've had a torn ACL for over a year and it's been symptomatic, meaning that you've had many issues of instability where your knee doesn't feel like it's going to hold you and you have buckling of your knee, I recommend getting it fixed with surgery. And so if it's been over a year, you probably need an ACL reconstruction to fix it and get stable and get back to playing any sport that you're willing to do. Caleb Comfort 13 says, is it smart to still play after both knees being blown out in the most recent 9 months ago? So a lot of people say they had their knees blown out. So as an orthopedic surgeon, that doesn't really mean much to us because that can mean a whole bunch of different things in terms of the injury. So you have to be very specific about what you mean by a blown out knee. But for the most part, people probably mean a blown out knee is like an ACL tear or something like that. But in my hands, an ACL tear is no reason to stop playing a sport as long as it gets fixed appropriately and you do the appropriate recovery and rehab. So any blown out knee is definitely no reason to stop playing your sport unless you do not get it addressed appropriately by an orthopedic surgeon. So Scythe25 says, shoulder issue where downward rotation hurts across the back of my shoulder. So I would say in general, if you have pain in the back of your shoulder, that's more coming from your neck issues, and that's more of a neck issue than necessarily your shoulder issue, and the muscles that surround and support your shoulder blade. So that's more of a rehab issue for the most part. So Shrikar says, what are some of the signs of improper recovery after ACL reconstruction? The major issue after ACL reconstruction is stiffness. So Stiffness after ACL reconstruction is one of the major hurdles to overcome, and people who do not get through that are at a disadvantage, as well as weakness. So weakness meaning that their muscles have not recovered appropriately is one of the downfalls of ACL reconstruction, and can cause problems about returning to sport. Um, so Una HB says, do you have any advice for prevention of injuries to soft tissues? Sudden trauma can't really be avoided unless you avoid intensity sports and repetitive damage. So I'm not sure what is best. So soft tissue injury basically is muscle strain or ligament injuries. And for the most part, that is due to overuse. So that has to do with improper training techniques, improper training surfaces, improper training equipment. So these are usually preventable causes of injury. So any muscle tears, muscle strains, things like that are usually preventable injuries. And that has to do with proper practice, proper training, proper warming up, and proper therapy. And so as an orthopedic surgeon, I don't necessarily treat these injuries specifically. So that has to do with proper physical therapy, proper athletic training to prevent injuries to the soft tissue and muscles and tendons in that aspect. Um, Again, if I missed your question, just send me a DM or a comment and I'll try to get to it at some point. Um, and so there's a question about what Thorbert says, what are the pros and cons of patella tendon autograft versus hamstring autograft? So patella tendon autograft is a very popular way for ACL reconstruction to be performed, especially in the US. It has a very low recurrence rate, anywhere from 3 to 5% or so. Hamstring autograft is very popular. It's more popular overseas in Europe and in other countries for ACL reconstruction. The downside of hamstring autograft is that it has been found to have a higher rate of rupture in long-term studies. And so in my opinion, I personally do not do hamstring autografts for that very reason. But in the right hands, people do it very well, and it's very commonly done in Europe. And I would say the biggest con for patella tendon autograft is that it can cause anterior knee pain, and that knee pain can be very detrimental and painful for a lot of people, especially people who kneel down and lay on their knees for work or for praying. I'm thinking it says some people are just born looking like doctors because I know he's a doctor just by looking. Thank you for that comment. um, Evan Dumpkin says, is it bad if I can subluxate my shoulder on command without pain? And so people with shoulder instability, so it's called multidirectional shoulder instability, and that's a disorder that some people have, that both their shoulders can basically come out of the socket and go back in. That's a condition that people are born with. It's not necessarily something that they develop, but unless it becomes an issue where it affects your activity, your function, it can be tolerated. But if it becomes a problem where you are not able to perform at work or do your sport, then it becomes a problem that needs to be addressed, usually with physical therapy. And if not, a fixation with surgery can help stabilize the shoulder appropriately. So someone says, is there any way I can speed up my recovery? Meniscus repair surgery. I am 6 months out from the surgery. So it takes a while for recovery after meniscus surgery because the meniscus doesn't have a great blood supply. So the recovery can be somewhat prolonged after a repair of the meniscus. And so I would say there really is no way to speed up the recovery after meniscus surgery. It is just a timeline where you have to heal because it takes a long time for the meniscus to heal in general because of that lack of blood supply. So just making sure you stay strong and get your range of motion back is the most beneficial way to do it. So Toby Salaki says, any research opportunities available with you at the moment? So I am constantly doing research. As a orthopedic surgeon at an academic institution, I do research with residents, med students, and fellows. So send me a DM if you want to do research with me. I'm happy to collaborate. So Dom says, what's the best ways to treat an avulsion fracture of the hamstring aside from surgery? It depends on how big the avulsion fracture is, if it or the avulsion is. The avulsion, it depends on the age. So if you have a very young patient, someone in their 12, like their 12, 13, or adolescence, avulsion fractures can occur where that can heal on its own after several months of physical therapy. But if it's a big avulsion, if you have a multiple tendons torn from your hamstring, because the hamstring is made up of several tendons. If you tear greater than 2 or 3 of these tendons and it is symptomatic, it usually is recommended to have surgery to fix it. So Cameron Voss says, Voss 41 says, is it real that athletes are actually injury prone or just bad luck? So that's a great question. So there is no one who's medically injury prone. They can be someone who has multiple injuries, but the issue with people who have lots of injuries, you have to kind of go and figure out what the baseline problem is. And usually it is training surfaces and training protocols that are causing the athlete to have multiple injuries, especially if they are soft tissue injuries like muscle strains, pulls, tears. Those are due to training and improper warming and stretching, warming up and stretching. And so the injury prone is not necessarily a trait of the athlete. It is more of a behavior and equipment thing that usually happens for some of these injuries. But for people who tear things like tear your ACLs, tear these other problems, and tear these other structures, that might just be bad luck for some of them. So Andrea, someone said something. Sorry. Andrea Esparza says, how long does a muscle atrophy last post ACL reconstruction using quad grafts? That's a great question. The weakness after a ACL with quad graft can last a long time, and it does normalize, but it can take a long time. It can take upwards of 2 years. So sometimes it's a long process of noticing the weakness, but some people are able to work through the weakness faster and get through that atrophy by basically working out and doing more weights. But it can last quite a bit of time in terms of the actual weakness. Too Hot Atlanta says, what made you choose your particular field? I chose orthopedic sports medicine because I like taking care of athletes, and I like the personalized nature of it, getting patients back to a competitive sport. So I'm a college football kicker, have a moderate groin tear that required PRP shot, estimated return to play. So PRP can be useful in some situations, especially with these tendon injuries and muscle injuries, and it can decrease the time to full healing by speeding up that process. So in general, I would say for muscle injuries, muscle tendon tears or strains, if you get a shot or some kind of intervention to help with the healing, it's anywhere from 3 to 6 weeks or so, but it just depends on the severity of the injury. So someone just said, I'm just answering this question here. Khalil says, a bare implant, lateral extra-articular desis, and lateral meniscus repair. When will I walk? So I would just say that there's probably only a few surgeons in the country who are able to do that procedure or who are currently doing that procedure. So I'll be interested to know who did that procedure. So what this guy is referring to here is that this particular person had a bare implant, meaning a bridge enhanced ACL reconstruction, or sorry, a bridge enhanced ACL repair to help to improve the repair, or to help to improve the healing of the ACL, had a lateral extra-articular tenodesis to decrease the chance of re-tear, and a lateral meniscus repair. And so that is a lot of surgery and a lot of kind of very specific type of surgery and repairs. And In general, I can't answer for your own surgeon, but I would be very slow in terms of the walking and ambulation in terms of postoperative protocols, because those are all techniques that require some delicate balance, especially the bare implant and lateral meniscus repair. So I would say in my practice with that particular combination of surgeries, it would probably take about 6 weeks of protected weight bearing with crutches before you can walk normally. So I'm going to skip around here. Sorry if I missed your question. Try to send me a DM. I have about 5 minutes left before I have to go. Um, um, So Lucas Ibakash says, is little clicking without pain and tightness common in shoulder labor and recovery 5 months after surgery? So I'd say yes, clicking and catching are very common for patients after labrum surgery because we use sutures or stitches to repair the labrum, and sometimes those stitches can rub up on the shoulder joint and cause this kind of clicking and popping. But if it's painless, we don't really get any concern about it because it usually is scar tissue or those stitches that are rubbing up against the joints sometimes. So that's not really a big concern in general in terms of what I tell my patients. So Mason AM says light swelling in the knee 10 plus years after meniscus surgery. Concerning, it goes down between sessions. So this is not directly related to your question, but I would say that any swelling in the knee that you notice is a reason to have it checked out, because the knee does not swell up for no good reason, basically. So anytime you have swelling in any joint, there is something happening. So whether that's a injury, whether that is some inflammation in general, but if there is regular swelling in the knee, I always tell a patient to get it checked out. Um, So Twan, one percenter, says, had ACL surgery in May and I still can't get my knee completely straight. So that's a hard problem to deal with. Getting your knee straight is probably one of the harder things to do after ACL surgery. And the clock is ticking after the ACL is done, because you don't want to get too stiff after the ACL, because if you miss a window of time, it's very hard to regain that extension and that flexion. And if you have had, or if someone that I know that I've operated on has not gotten full extension after about 3 months, I pretty much say that it is you have the extension that you have, and you may not get the full extension. And so I typically see patients at several time points during the whole recovery process, and if they are not getting their full recovery or their full range of motion back, I intervene by doing a procedure to get their range of motion back in surgery, or do some kind of procedure that helps them get that full extension and full flexion as soon as possible, because that's the issue that doesn't necessarily get better on its own. Um, so sorry, I have a couple more to answers and I have to get going. Um, so Olivia S says, I have hamstring tendinopathy and I was wondering how that happens and how to heal. So hamstring tendinopathy basically is recurrent injuries to the hamstring, usually from overuse injuries, and the hamstring tendon is not healing properly. So that's what tendinopathy basically means. It is a disordered healing of a tendon. And that usually requires rest, physical therapy, usually stretching, strengthening to a certain point, to a certain extent, and then gradually going back to a sport if that's what you're doing. And so that is the basics of healing any kind of tendinopathy. It's rest and rehab. Um, so a couple more questions. Um, Hey doc, best way to protect your Achilles while playing basketball. Best way to protect your Achilles is to stretch appropriately and never ignore any minor pain in your Achilles, because usually Achilles tendon tears happen um, in people who have had chronic Achilles tendonitis, meaning they've had pain in their Achilles for a while and haven't had it necessarily addressed. So I have two more questions that I have to go, and I purposely am not answering questions about other body parts besides the shoulder, hip, and knee. So sorry if I'm not answering your elbow or wrist or other questions. Um, a lot of questions about. So sorry, I'm trying to get one more question here. So again, Josh got Durag says, what about Oscar sliders? So as I've said before, Oscar sliders usually gets better with rest and physical therapy. If you haven't gotten better in 3 years, which is what your question is, then I'd question what the diagnosis is. So you should have it checked out again by another orthopedic surgeon. Yes, I've used Arthrex. Thanks, Malik Jones. Um, so Sam Odigobo says, I had 2 labrum tears and hip microfracture surgeries. How should I train to get flexible and hoop? So that's all about staying flexible in your hips and making sure that the recovery process was appropriately followed in terms of the rehab protocols, making sure you didn't rush going back to your sport. And if the labrum tears and everything else was appropriately treated, you should not have major issues as you go back and do a return to sport. All right, so Josh says, how do I know if I tore my labrum? I think you can't know unless you get it checked out by an orthopedic surgeon and an MRI is followed or MRI is ordered, because you can't know specifically what structures damaged until you get that image appropriately. Okay, so thank you everybody for joining. I have to go. Sorry to leave everybody hanging. If you have any more questions, but again, if I missed anything, please send me a DM. Thanks for joining today, and look forward to catching up another time next week on your sports medicine injury questions. Take care. Bye.